Thank you. Thank you, Marcella and the comms team, and also thanks to the Uganda team. And good morning, good afternoon, everyone. All protocols observed. Today's briefing session is on our centrally managed limited investments. That's what CMLI stands for. And this is Project Stellar 2.0. And on this part of Stellar is on sustainability and really institutionalizing lab system strengthening interventions towards sustainable lab systems and diagnostic network. So as part of this initiative, which is part of Stellar, which most of you in this call should know, Stellar started in 2021 in response to challenges with diagnostics and lab systems in countries that Global Fund invested funds, but they were lagging and not meeting the WHO targets. So Stellar was formed in collaboration with AU-CDC and several partners. Support was provided to 23 countries to increase diagnostics, COVID diagnostics, but also establishing capacity for wastewater-based surveillance. And later, we pivoted when COVID was no longer a public health emergency, disease of emergency concern, and we were supporting lab systems. So then we are now expanding to 9 new countries that were not part of the initial Stellar, but also expanding on wastewater-based surveillance investment. So with this new initiative, which is Stellar 2.0, we're basically working with countries that have proven successes in lab systems, interventions, and linking them with other countries that are implementing the same, such that they can learn from each other. And all this is to ensure that we implement interventions that are in our funding request, both C19 or GC7, the current cycle, and also to ensure that these funds are absorbed and we see impact, not just for HTM, but also for pandemic response. Next slide. So here, I'm just going to show some successes of Project Stellar thus far, but I'm not going to go into details. We will share these slides with everyone on this call. So we have succeeded in really improving policy governance, data systems integration, strengthening various aspects of the lab systems and integrated quality testing plus surveillance. And this, as you know, is being supported by EPHL CHI and ASLM. But in this new initiative, we're moving away from international TA providers or TA providers, but basically using ourselves, using the capacity that we have built to move forward. Next slide. So here, I'll just give you a brief overview of, so that you will understand the investments that Global Fund is making in labs. And as you see in the past funding cycle, which was GC6, we only had 108 million invested by the 124 countries that are supported by Global Fund in lab systems, and this does not include the diagnostic products. And in GC7, we saw 124 million, but then we saw an unprecedented increase in funding during C19, about 331 million. And on the right, you will see how this is broken down by lab systems interventions. So we see a lot of funds in equipment, but also infrastructure and also specimen referral, but also lab information systems, and also on quality management systems, as you could see a huge jump in GC7. And why is this? In GC7, all the countries that are invested in quality management systems are required to report, and it's mandatory for countries to report on participation in PT schemes. So, and we also understand the bottlenecks in countries regarding quality management systems and also availability and access to proficiency testing panels. So Uganda has built a system of producing proficiency testing panels for HIV, TB, and several other diagnostic tests. But most importantly, recently, they have established capacity to produce proficiency testing panel for malaria RDT. And I can assure you a number of you are doing malaria RDT testing or are being done down at the community level by non-lab cadres, but there is no system to ensure the quality of testing using malaria RDT. So with this in mind, we then came up with this initiative to support countries to to build capacity for malaria RDT, go to Uganda, see how it is done, and then go back to their countries and establish. And not just malaria. If it's TB that is your interest, or HIV is your interest, you will discuss this with Uganda, and we will see how we can incorporate this in the training whilst you were in Uganda. But the main reason why we set this up is to build capacity for malaria RDT, rapid diagnostic testing, proficiency testing panels. Next. So like I already said, this is about institutionalizing strengthening towards sustainable lab systems and leveraging on regional capacity that we already have in the region. So we have identified Uganda, as I said, as the country that will be leading the peer learning on PT panel production, but also to note that EXA, the Eastern Central Southern Africa, which a number of you already have been working with, will be the coordinator of this initiative, and you will hear from them in a few minutes. Next. So here, I will just focus on the countries that will be going to Uganda to learn from Uganda on EQA and PT panel production. So we're going to have 3 cohorts because we have a lot of countries that are interested, and we did not want to have more than 4 countries together at one time, such that the learning can really progress well. So we have in the first cohort countries like Ethiopia, Zambia, Tanzania, and Zimbabwe. And these countries, we group them together because they have already established capacity for HIV as well as for TB. So for them, it is just for the malaria RDT, and it will be something that they have in common, and so they can learn from each other. For the second cohort, which will be Kenya, Sierra Leone, and South Sudan, also some but not all capacity exists. But they will also have an opportunity to learn from each other, and Sierra Leone, Sudan can also learn from the experiences from Kenya as well as Uganda. And then the third cohort is Togo, Guinea, and DRC, and we group these together because of language. So they're all the Francophone countries, and do not worry, there will be translation in Uganda during the training. It will be provided in cohort 3. So just to note that it will be very difficult to change the cohort you are in, but we will work with you in case any changes are being requested. So Uganda in their presentation will inform of the dates for all 3 cohorts, and then we will link you up with Uganda, and you could start the discussion and basically informing them of what you're expecting from the training, but also what the plans would be after the training. During the training, each country will have an opportunity, whilst you're in Uganda, to develop a plan, an action plan after the training, what you will do when you go back to your country. You will also have an opportunity for Uganda to come and visit your country to see what you're doing post the training. So the training plan that you will be developing in Uganda is very important for follow-up. Next slide. So what are we expecting from this? And some of this I've already alluded to. We're expecting improved scores in your SPA and JEE when you report, and also a positive reflection on the RSSH lab indicator, which is RSSH 3, which you will report on PT panel participation. And then we would like to see enhanced engagement between the PRs and the lab directorates. The lab directors taking ownership on implementation of activities relating to quality management system, but also other also lab investments. But also we want to see increased fund absorption and impactful service delivery. We want to see that when you go back to your country, you could go and talk to your PR, talk to your Global Fund country team, talk to ministries of health, talk to your permanent sectors to ensure that these funds are released, overcome the administrative bottlenecks, such that we could swiftly implement the initiatives, and we see absorption. And to keep in mind that we're working on the next replenishment as we speak, which is GC8. And we want to see that we use these funds in GC7, C19. We see impactful results such that replenishment could be successful. So we kindly also always ask you, talk to your Global Fund country teams, talk to your Global Fund lab advisors with any challenges, with any gaps that you see, and such that we will try to mitigate. If it's something you need to proceed and you're not getting, or there's no funds, or there are hurdles, talk to your Global Fund country team, and they will work with you to see how we can mitigate some of these gaps. We also want to strengthen and foster relationship between networks. Like I said, you were going with 3 other countries to Uganda. You have Uganda as well. So, continue this relationship. I mean, set up WhatsApp group. Community of practices will be set up after each training to allow continuous collaboration and discussions between countries. There will also be pre and post training assessments. Like I said, there was also, you will be expected to produce an action plan post the training. And so we will also be following up on that, like I said. Next slide. Can we go to the one for Uganda? Next, not this one. There's one slide. Yeah, this one here. So this slide just shows you what is happening in Uganda as far as they've established their national EQA program. And theirs is not just national, but also they are supporting other countries in the region. As you can see, they do 2 to 3 surveys a year on a multitude of tests for HIV, TB, COVID, and also other tests like HPV, cryptococcal, and syphilis. And they are ISO accredited for most of the assays. And they also work with other partners. But most importantly, they support PT programs through the EXA grant, which is supported by Global Fund and others by USG, where they support other countries, and they also support root cause analysis where, if needed, after the country does conduct their root cause analysis and cannot find what the gaps are, what the problems are, then they usually go to the countries to help them unravel the gaps and all the problems. So the map just shows the countries that are participating in some of the PTs. I think I'll end here and I'll hand over to Uganda.
Thank you so much, Dr. Fatim. Good morning, good afternoon, colleagues. We are going to present the concept of our training plan for the peer-peer learning, focusing on EQA PT. We shall give an overview of our overall EQA PT schemes, but finally focus on malaria, because as you heard Dr. Fatim saying, that this main peer-to-peer learning was focused on PT malaria, but as the countries come in, we can have discussions to see how we can support the other PT schemes that you want to do. So that's how we're going to skew the presentation. Over to you, Charles, to make the presentation.
Okay, good morning. Thank you so much, Dr. Susan. I'm going to take us through the capacity building and sustainability.
Sorry, Charles, can you put it on presentation mode, please, so that it will be bigger for everybody?
It is. But in its presentation mode this side.
No, go to display setting. Click on display setting and switch it. Display setting is on the top, the second on the top. Yeah, that you saw it, the next one, not that one. Go to the next one. Yeah, click down. Yep, swap. The first one, swap. Thank you. It's good now. Proceed. Sorry.
Thank you, Patrick, for that. So I'm going to take us through presentation on capability of the capacity building quality laboratory system through implementation of proficiency panel. When you look at our vision as NHLDS, is to ensure quality laboratory services are available, accessible to all people in Uganda, with the mission of having a healthy and productive population that contributes to socio-economic growth and national development. And the vision 2040 is to have a transformed Uganda society from a peasant to a modern and prosperous country within 30 years. As an introduction, NHLDS is under Ministry of Health with the Directorate of Public Health, and it has a Department of National Health and Laboratory Diagnostic Services, where we have three major components. This is stewardship and coordination that are involved in policy formulation and development of guidelines and standards. Then we have the diagnostic aspect, which is reference laboratories. We have the Central Public Health Lab, the National Microbiology Reference Lab, and the National TB Reference Laboratory. And then we also have Quality Assurance Division, where we provide reference testing, quality assurance for different tests within the laboratory network. When you look at the tier of the National Health Laboratory Diagnostic Network, you realize that we collaborate with the university, we collaborate with the animal health, as well as regulatory agencies, including private laboratories. But when it comes to national laboratory services, the National Health and Diagnostic Laboratory Services actually oversees the network of laboratory diagnostics. And majorly, it offers super specialized reference testing. And when you look at this slide, it has the National TB Reference Laboratory, which also acts as a supranational reference laboratory in East and Central Africa. And also it helps in MTB surveillance as well as quality assurance. Then Central Public Health Laboratories, it has the Clinical Molecular Reference Laboratories, the National Microbiology Reference Laboratory, Genomics Reference Laboratory, Malaria Reference Laboratory, Diagnostic Evaluation Lab, and National Biorepository. These form the key or the core elements of the Central Public Health Laboratories. Then we have the National Equipment Calibration Center, which is part of the National Health Laboratory and Diagnostic Services, and they majorly offer calibration of auxiliary equipment as well as certification of biosafety cabinets, in addition to laboratory equipment maintenance, especially for medical laboratory services. And they also offer in-service training with an accredited scheme of training. We also have a quality assurance laboratory, and we provide quite an array of EQA schemes. We have HIV EID EQA, HIV viral load EQA, serum CRAG EQA, TB EQA, microbiology and AST EQA. And as Fatima said, we also offer malaria EQA, which is actually a rapid diagnostic test that has been quite a challenge within the diagnostic network in the region. In addition to this, we have quite an array of activities. To just mention the capacity NHLDS has, stemming from equipment maintenance and calibration, the National External Quality Assessment. We also take lead in biosafety and biosecurity, and laboratory information management system, which is core when it comes to optimization of the network and also utilization of the data within the network, and supporting the network in laboratory supply chain and logistic management. We play a key role in ensuring that there is continuity of service. And we are a hub actually when it comes to training and capacity building, and that's why then peer-to-peer learning has been advanced to be in Uganda as NHLDS takes a lead. And in this, we are offering a catalytic approach where we ensure that laboratories who are implementing these activities, they take up the technology and go ahead and implement and improve on the laboratory network within their country. And also peer-to-peer learning encourages the aspect of different laboratory personnel from different backgrounds sharing their experiences, and then they get to know how best they can optimize and improve their network. We also have a robust integrated specimen referral network, which ensures that the samples as well as EQA panels are delivered to the respective testing facilities, and results are relayed back within time. Biorepository and research is also a major element that NHLDS oversee. We shall now basically look at the National External Quality Assessment Program. At NHLDS, the goal is to monitor the performance of laboratory and enabling improvement in laboratory testing. And the objective is to provide actually a high quality EQA panels to ensure consistent, accurate diagnosis while facilitating ongoing improvement and compliance with the ISO standards. And this is done through continual education. It's done through continual feedback, right from the participants, looking at the laboratories, looking at the laboratories with good practices, as well as picking what the network needs in order to improve the livelihood and the testing capability of samples. And this is done through mentorship, targeted mentorship, as well as peer-to-peer learning, performance monitoring, and also establishing the corrective action measure. To do this external quality program has actually the 3 tiers. It has the EQA provider process, then it has the participant process, and then it has the M&E process, which involves a coordination process to see how effective the EQA program is being implemented. The first thing we do when it comes to EQA provider is to provide panels which are actually standardized and well established to ensure that the facilities reach or receive these panels through an existing specimen referral network where we are able to distribute these panels. Then on the other side, these panels will be delivered to the enrolled participants on various schemes. The participants will analyze the panels, and then they will process these panels, give us the results. And when you give us the results, we shall actually analyze these results and provide feedback reports to participants. Now, this is done per cycle of EQA scheme. And on an annual basis, sit now and evaluate how the performance has been. And this is where we are going to see how effective the EQA program has been. This is through performance review meetings, as well as dissemination meetings with stakeholders. Where there have been bottlenecks, this is where we are able to identify areas of improvement and also identify additional resources. So basically, this is how an effective equipment EQA program is implemented. Now, looking at this gap that we do have in the network of ensuring that we have quality diagnostics implemented by individuals. The Maputo Declaration of 2008 advocated for commitment from national governments to prioritize support and also harmonize laboratory system through development of comprehensive national laboratory strategies, policies in sub-Saharan Africa. And as such, actually Uganda has embraced this, and it has supported the laboratory transformation and suboptimal improvement in diagnostic services. And through this, it has come up with innovative quality improvement programs. For example, the current malaria RDT, which is novel in the region, that different laboratory networks have been grappling with. And this actually has improved laboratories And now we are using this to combat emerging health threats. In addition to that, the National External Quality Assessment Program was also established to provide PT materials, and this also enables to monitor the performance of the laboratory services, to enable quality laboratory testing, and also to provide programs which have high quality EQA panels. And this is just to ensure that there is consistent, accurate diagnosis while facilitating ongoing improvement and compliance with the ISO standard. In addition to that, we are helping the laboratories actually to adhere to the ISO 17043 program. When you look at that, we have quite an array of EQA we're providing. And when you look at this slide, you are able to see the number of schemes we are able to provide and participants that are able to participate in these programs. I will base so much on malaria RDT, which has been the bottleneck. And when you look at this, it actually gives a true picture of how robust our malaria RDT has been, looking at the different banding patterns of the positive and also of the samples that we have developed in the lab. And in this, when you look at the pilots which were conducted as well as the participation, there has been a rapid increase in the number of enrolled participants, and also the number of participants who have responded has actually increased exponentially. And this already indicates that there has been quite an impact when it comes to malaria RDT implementation and in ensuring that there is quality diagnostics. When you look at the response rate, which is one of the indicators that we do look for, and the pass rate, you see that all participants that participated actually get the right results, meaning that our panels are actually robust enough. This is just an integrated laboratory system, and we came up with this model to facilitate peer-to-peer learning as far as Stellar project is concerned, to ensure that through a catalytic approach, we are able to develop capacity and ensure sustainability of EQ implementation, as well as ensuring that laboratories develop capacity to do diagnostic within their network. The main objective here is to institutionalize or strengthen sustainability of laboratory system and laboratory networks, also leveraging on established regional capacity to promote peer learning, and this is a twinning model to enhance funds absorption as well as implementation for impact and limit resilience on international technical assistance, leadership training as well. And when you look at these objectives, we looked at EQ and PT panel production intervention, and some mentees have been selected who are starred in different cohorts, as Fatim had indicated. And here we are looking at how to share the knowledge and best practices on establishing and implementing a national proficiency testing program through peer-to-peer learning. And specifically, we are going to look at or develop capacity on production and management of PT schemes for essential diagnostic services within the country network, as well as providing technical assistance and mentorship on PT implementation. The training plan, for us to be in position to achieve these targets, we are going to have a peer-to-peer learning that will involve individuals exchanging knowledge and experiences, as I mentioned before, and having an ability to explain, okay, and ability to have them implement these in their country. Next slide. So far, pre-foundation engagement has been achieved by setting learning objectives, establishing peer group foundation, and selecting target groups, and the activities will involve participants identification and teaming. And also, Right now, we are looking at the foundation engagement to foster peer engagement and participation orientation, and also initial briefing meetings with peer individuals, what is happening right now, which is the virtual engagement, and then individual country situation analysis to clarify specific objectives, identifying resources and capacity required. And these activities has been identified as follows. We have the online orientation, which is happening now. Then situational analysis or gap analysis using the checklist will happen the coming month. The step 2 is actual peer-to-peer learning phase. This is where we shall have site visits and face-to-face connection, as well as virtual meetings and online network and joint peer activities. So this is where we are going to have capacity building on production of the EQA skills. The third step is actually a practical learning and implementation in respective countries, where we are going now to follow up and see how best or how effective have they picked up this knowledge. And this will involve actually facilitators from lead countries to visit countries to monitor EQA production and also offer technical assistance for evaluating effectiveness of the training program. At the end of the day, we want to see how participants use this knowledge to improve the network, how participants use this knowledge to inform others, so that this can be a cascaded event and also can be published and also improve the policies in their own network. When you look at the peer engagement, we have the level of activity, which is facilitated at the National Health Laboratory Services, and then trickling down now to the national level, where we want to see how best the national or country has taken up this knowledge. This is our training plan. And when you look at the training plan, we have 3 cohorts. And in each of these cohorts, we have foundation engagement, which is actually happening between June and July, where we are engaging participants. And then we shall have now the contacts with participants. And this is where cohort 1, we are envisaging to start this in August and September, where we are going to have people from cohort 1 actually having a training at NHLDS. Cohort 2 will have this in October and November, while cohort 3 will have this in December, January. Then we have on-site technical assistance. These on-site technical assistance will actually happen after 6 months of implementation, just to give room for the participants to go and implement, set up, and also we shall be doing virtual follow-ups so that we prepare participants to start the implementation. Then the on-site visits will involve actually evaluation to see the impact the training has had. Then in the next financial year or next year, that's where we are going to evaluate and see how effective this has been. Because the outcome here is to have a pool of competent individuals who are trained in preparing and managing EQA panels. And the final outcome is to scale up production, distribute, and also manage the EQA panels and programs integrated in the national system. With that, I say merci. Thank you very much. Back to you, Chair.
Thank you so much, Charles. Back to you, Dr. Fatim and Esther.
Thank you so much, Suzanne. And I think, thank you so much for that wonderful presentation. I think we will need to talk about cohort 2 and cohort 3 training, the timelines. If you could just share, Charles, the timelines that you said. I think we should discuss that, because like I said, this is about implementation and accelerating implementation of C19 and GC7 grants. So I think in your training plan, we really need to consider that these countries need to set up and establish this capacity such that they can absorb the funds. C19 grant ends December 2025. So all work should be done. So we were really hoping that countries can finish their peer learning by the end of this year. So I know you have a busy schedule. I know things are very busy in Uganda, but let us at least try to push a little bit cohort 3 such that they could come earlier than December. I think January, you said December, I can't remember. So I think, I'm not sure who's sharing a slide, but we don't need this slide. I'm not sure who's sharing.
We're sharing. We'll remove.
No, remove this. We don't need this.
Yeah. Okay.
This doesn't apply here. Thanks.
Okay.
We don't need. You don't need to share anything anymore. Thanks.
Okay.
So for now, we will just let Andrew speak on EXA and EXA's role in this. But Susan, we'll get back to you and your team. Yeah, exactly. This is the slide I was talking about. So you will have August, September cohort 1 coming to Uganda, and this is only for 2 weeks. So we need to know the exact date. Is it in August? Is it in September? It's only for 2 weeks that they come in. So if you could give us the exact date between these 2 months when they're coming. And also you then said October, November for cohort 2. If cohort 1 will come in August, I think cohort 2 can also come either in September, and then cohort 3 can then come in October. That would really work for this project. It's about accelerating, and they need to go back and set up, and they need to go back and work. They need to go back and decide if they need equipment or what they need to procure. So we cannot have them, especially cohort 3, come in January, February of 2025. We were hoping that the learning will end by December. So if you could look at your schedules again and give us exact week date for each of the cohorts, we'll really appreciate that. So with that, I'll just hand over now to Andrew from EXA. Andrew, over to you.
Yeah, Fatima, as Andrew comes in, that's noted. We are going to share the exact dates, and with your guidance, I think by October, we should have all the 3 cohorts in. Thank you.
Is Andrew on the line? Wait, yeah. Team, can you check if Andrew is asking to speak? He has his hand up, so I don't know if that's the problem.
He's on the line, definitely on the line.
Yeah, because we saw him coming.
Maybe we give him
he needs to accept. Yeah.
Thank you very much, Fatah. So I'll speak very briefly about EXA's role in this initiative. For those that may not be aware yet, the East Central and Southern Africa Health Community, EXA in short, is an intergovernmental organization comprised of 9 member states in the East Central and Southern Africa region. We have the mandate of fostering collaboration in health among our member states and beyond. And we've been a principal recipient of the Global Fund since around 2015. And since then, we've been implementing various Global Fund grants. Flagship projects has been the Regional TB Lab Strengthening Project, which covers 21 countries across the continent, supporting national TB reference labs. And I'm pleased to note that we've worked with quite a good number of the participants that will be part of this peer-to-peer learning initiative. You may be interested to know that we've just been awarded another new grant, which will run for the next 3 years, which will focus on integrated lab systems strengthening. With regard to the peer-to-peer learning initiative, we are very pleased that the Global Fund has contracted EXA to coordinate and facilitate the peer-to-peer learning. What this entails is that EXA will be responsible for your travel, accommodation, allowances, supporting you with your visa applications, and so on and so forth. But also ensuring that as the peer-to-peer learning initiative is being implemented, we will track the progress and document the activities that will be going on so that we ensure that we are achieving the anticipated outcomes as per the theory of change. So we look forward to working with each one of you, and we trust that this initiative will go very smoothly. Would like to emphasize that it is important that you feel free to get in touch with us at any time, because we'd like to be as responsive as possible in addressing all the issues that arise and ensuring that the implementation goes very, very effectively and efficiently. That is my submission for this morning. Thank you, and over to the chair.
So much, Andrew, and again, thank you, Uganda. So I guess now we move to the question and answer sessions. I'm not sure if there are any questions. If you have questions, you want to raise your hands or you want to post it in the chat and we will present it, that's fine. So I hand over to our comms team to lead this session. Over to you, Marcella and team.
Yeah, thanks, Fatima. If you can go to the next slide, I think we have one or two questions. So the first one is that I would like to know which panels are produced in Uganda. Fatim, we'll pass back to Dr. Susan.
Every cohort is expected to be here for 2 weeks in Uganda. Hello?
Susan, the question was, they wanted to know what panels are produced in Uganda. I think you did share that, but you could just summarize and we'll share the slides so they have the details. Question number 1.
Dr. Susan, can you hear us? They want to know which panels are produced in Uganda. The other thing we can do is, we can hear you now.
Panels. Yeah, those are the panels that are produced in Uganda, but specifically, as Dr. Fatim said, this main peer-to-peer is for malaria, but as we have the countries in country, we can have a discussion for the others, but this one is specifically for malaria.
Maybe if you stop sharing and we flash that slide of the panel.
Can you hear us?
Yeah, we can hear you. You can share slides again so that we can see that that slide, and then we'll put up the questions again. And in the meantime, if people want to put other questions in the chat or raise your hands, we'll have a few more minutes.
Yeah, that's can you see the slide now?
Yeah, we can see it.
Yeah.
Yes, so those are the panels we produce here in country, in Uganda. But the training and the peer-to-peer learning specifically for malaria RDT panel, not for all the panels. So that has to be very clear, as Dr. Fatim said. But we can have engagements and discussions for the others. Yes, yeah.
Dr. Susan, if you can then later maybe send Fatima or any of us the presentation, and we can share it with participants so that they can have this information as well, if you don't mind.
No, we'll share
Perfect.
The presentation.
Thank you.
I think the presentation is, the size is big. So Susan, if you could just
PDF it or
that's
yes. Okay. Then the number of days in Uganda will be 2 weeks. Each cohort will be here for 2 weeks, as we've been. So we are going to give the exact dates for each cohort. Yeah.
Okay, so how long? So we've done the second question. The third question is how to join the tuberculosis group.
I don't understand this question.
Yeah, I don't understand.
Maybe there's no tuberculosis group, but if they want support, this is from Togo. If you want support on establishing PT panels for TB, we can then discuss this and see how it is possible. If you already have in your grants capacity funds to be able to produce the panels, then we can work with you. But we need to know that if after the training you will actually be implementing in your country, which means you'll have capacity to produce the panels in your country, you have the funds. Otherwise, we can link you with the TB reference lab in Benin, They do produce panels for TB, and they do send it to countries through another initiative that we have for West Africa. So please discuss with Juliet. Juliet will take your name and number, and I'm sure you already know her, but you will discuss with her what the actual needs are. But this visit to Uganda is to prepare malaria PT panels. However, they do have capacity to produce the PT panels for TB. Whilst you are there, you can have an opportunity to visit the lab, but they will not provide training on preparing TB proficiency testing panels. Over. I hope my response is clear.
Thanks, Fatim. For the next question is, when can we expect the official invitations letter? We need them to, for approvals from the respective countries. Is that for you, Fatim, or is Uganda who would be sending?
I would take this, and EXA would come in. So
okay.
So everyone that has been nominated that is present here today was nominated from your ministries of health. They gave us the names. However, we understand invitations letters are needed for visa purposes. So EXA on the line will be sending the invitation letters that will help with the visas, and I guess if you need final approval. It depends country by country, but your names were you were selected by your governments already. So I'm assuming that is already approval for you to come. And so EXA will send invitation letters so they will help with visas and whatever you need, the invitation letters. And EXA will provide details on your flights, on your hotel, on your per diem, will all be handled by EXA. Andrew, I don't know whether you want to come in. Over.
Thank you, Fatim. I think you've really said it all. Following this orientation session, we will be liaising with our colleagues in Uganda early next week, just to firm up on the dates and other details, soon after which we'll be able to send the invitation letters. So these invitation letters will come from EXA, and as Fatima has indicated, they will assist to those that require visa application to use the same as they prepare to come to Uganda. So expect them anytime beginning later next week. Thank you.
So
Thanks, Dr.
Uganda, as soon as Uganda gives us the dates for all 3 cohorts, EXA will prepare and share the invitation letters. So that will be the next step. Thanks.
Fatim, to EXA we'll share the dates with EXA this afternoon.
So we have another question from Togo. Is it possible to learn about production of biochemistry and hematology as well? And if we can, Gray, and go to the next set of questions in the meantime. Fatim, is this Uganda who will respond?
I think this one, I will let Susan talk about it as well, whether they have the capacity. But even if they have the capacity, again, this training is focused on malaria RDT. If they have the capacity, and this is something that you're interested in for chemistry and hematology, we can discuss this with them for another opportunity, another time where you will go and learn, or they will come to your country and help. Again, most importantly, you should have funds in the country to actually implement after training. But over to Susan about capacity.
Yes, Fatim, we developed capacity for chemistry and hematology, but as you guided in your remarks, opening remarks, that this is focused on PT, on malaria, but as countries come in, we can have discussions on how we can support in the other PT areas, and then the discussions can be put to Global Fund or in-country Global Fund mechanism.
Thank you so much. So again, this is peer learning for sustainability. So everything is possible. This is opening you up to talk to your peers. You could talk to Uganda if you want to build capacity in TB, in malaria, in HIV, in chemistry and hematology. You now know Uganda, you have been there, you have seen what they have, and then you can start the discussion. if you don't have funding in your country currently to do what you would like to do, for instance, you could discuss with your Global Fund country teams, with your PRs, and say, look, we have a priority, we have funding gap. In case there's savings, then we would like to establish such capacity. So it's all about discussing with your peers, but also with your PRs and also with your country team. So nothing is impossible, I would say. Everything is possible. We just need to discuss, and we need to start this peer learning. This is what this is. Thank you.
Thanks, Fatim. We only have a few more minutes because we aware we have the interpreters not for much longer. So I'll go quickly on how do environmental conditions such as, do you want to respond to these ones, Fatim, now, or should we go through the ones that are more about the webinar and
let's do the webinar one. Doris,
yeah.
we'll answer this later when you discuss with Uganda. But yeah, let's do the ones that are
are related to the organization. So I think it's the agenda presented showed that the group is planned for 2025, and a recommendation was made to reduce the period to 2024. When could we have the precision on the period for group 3? And is it possible to change a participant who has been nominated by another whose profile is more suitable?
Yes. So we are discussing, and Uganda will share the dates for all groups today. Today we have all your emails. For those that are nominated, we have your emails. We will send you an email with the dates, and EXA would also communicate. If you want to change a person, I'm not sure who's doing the change, but this has to be done through the right mechanisms. So write to us, copy your country team, and explain to us the change. But we really want to have the right people come. This is a hands-on training on people that are going to go back to the country, technical people that will go back and do it. It will be good to get somebody at the policy level who might not be able to do the technical work, but will be there to see how things are done such that they can support the technical colleagues when they go back. So at least 2 people should be technical. The third person can be like the head of the QA program and wants to just come and see. They don't do anything day to day, but they're responsible for policy and governance, because that's also important to see how Uganda started it, how coming up with the guidance, with the policies, navigating through all the administrative or all the political issues. So it will be good to have somebody who is not technical, actually. So that's why we gave opportunity for 3 people. So if you're changing, let us know why they change. So you have 2 people that should be technical, but 1 person can be technical if you want, but we would rather have somebody, a policy person. And then the last one, yes, we will share the presentations.
So I think we're fine. Yeah, Juliet has the hand up, and we close with Juliet. If we can, Juliet, can you speak?
Oh, that was a mistake. I didn't mean to raise my hand.
Okay.
But
hi, Juliet.
Can I just say thank you to everyone? I think this is very, very exciting, and I will follow up with Togo separately about the TB question. Over.
Sounds good. And we will also follow up with Doris on her question that we haven't responded. But Fatim, if you want to close, we can go ahead and we'll share the presentation and the recording with participants.
Thank you so much, Marcella. And again, thank you so much for all the attendees. Thank you for the presenters. We're really looking forward to embarking on this very, very exciting project, and to show that we in Africa can solve Africa's problems. We can work with each other. So I'm really excited and looking forward to this. Again, reach out to your country teams, reach out to your Global Fund Lab advisors if you have any questions, or if you have any doubts in your mind about this. But the whole point again is really going to Uganda, learning, but most importantly, implementing in your countries. So if there's equipment that you need, if you go to Uganda and see that they have an equipment, but you don't have it in your country, write quickly to your PRs, write quickly to your country teams, and put this request, even if there's no funds, but at least they have your request. If there's funds available, they will consider it. So let us be very, very proactive, and really let's move quality diagnostics in the region. Thank you again so much, and have a good afternoon.